More than 19 million new cancer cases and around 10 million deaths due to cancer occurred in 2020 worldwide. The predictions for 2040 from the International Agency for Research on Cancer, IARC, assuming only demographic changes, show an increase of almost 50% in incidence and more than 60% in mortality due to cancer. This translates to an impressive burden of almost 400 million new cases in the next 20 years worldwide, not even taking into account the risk factors effect. The good news is that prevention offers the most cost-effective long-term strategy for cancer control. We know that at least 40% of all cancers could be prevented with primary prevention, as they are due to modifiable or even avoidable risk factors. Secondary prevention or early detection can also reduce incidence and mortality of some cancers. The World Code Against Cancer Framework is an IARC-led multi-stakeholder initiative to develop and disseminate regional codes against cancer to promote cancer prevention globally. Some risk factors are common worldwide. However, some regions of the world have specific cancer patterns and, more importantly, differences in socioeconomic and cultural conditions and unequal access to effective cancer prevention interventions. The framework provides an umbrella strategy based on a common and rigorous methodology to develop region-specific cancer prevention recommendations and maintain the coherence of the different regional codes against cancer. Regional codes will be developed independently and will be based on reviewing and summarizing the latest scientific evidence on lifestyle, environmental, occupational, and infectious risk factors and effective medical interventions. This evidence will be then translated into cancer prevention recommendations at individual and population level. Regional codes will be adapted to different audiences, focusing on the individual, but also targeting frontline health professionals and policymakers by including recommendations on policies and capacity building for primary care professionals. Each regional code is produced by a large number of experts and supported by partners from each region, and coordinated by IARC. The development phase includes technical working groups of independent experts in epidemiology, public health, and communication, supported by experts in systematic literature reviews. A regional scientific committee assesses the recommendations, and cancer prevention advocates are instrumental for the future implementation of the regional code in the respective countries. Regional codes against cancer will assess the needs of the specific region, considering not only epidemiological factors, but also social inequalities and economic barriers, health systems capacities, and challenges in implementing the recommended policies and innovations. The framework includes the European Code Against Cancer 4th edition, which contains 12 recommendations and an additional comprehensive website with more than 200 questions and answers related to the recommendations and other topics, and 14 scientific peer-reviewed articles documenting the project and the recommendations. The framework is currently being applied to the first Latin American and the Caribbean Code Against Cancer to be launched in early 2023.